Hey guys, this is Dave Hess. Cupping is something that's getting a lot of attention recently because of the Olympic swimmers and the bruises they have on their bodies. But it's a therapy that's been around for over 3,000 years. So we're here at Palm Beach Healing Arts to show you what it's all about. This is... So we're here with Dr. Borse. Doc, thanks so much for doing this with us.
Absolutely.
So what is cupping?
So cupping is a modality within Chinese medicine, not much heard of. Most likely acupuncture is the one that most people identify with. But like acupuncture, cupping, moxibustion, as well as another technique called gua sha, kind of compromise in addition to herbal medicine, traditional Chinese medicine. Cupping is actually where we utilize glass cups and we basically suction out the air. So it's like a reverse massage. Instead of putting pressure into the muscles, we pull pressure out of the muscles. And that actually creates more blood flow and more circulation throughout the tissues.
So is this something that's used more for recovery from an injury or prevention from future injuries?
So it can be used for a variety of reasons. Cupping can be used definitely after an injury has occurred when there is what we call blood stagnation in Chinese medicine, where there's a lack of flow or circulation through the tissue. Cupping can actually help create more circulation and relieve pain, which will then relieve some of that stagnation. It can also just be used for chronic pain. So a lot of times people who have chronic back pain, chronic neck pain, or just tightness will benefit greatly from cupping. And it's also used a lot for actually anxiety. So a lot of people actually find a lot of relief, or if they don't like needles, we can use cups on the back to help calm the mind, calm the shen. And then we use it sometimes for high blood pressure and hypertension. It's also used a lot nowadays for treatment of weight loss, and even for the treatment of cellulite. So it kind of has a scope much broader than just the musculoskeletal condition that it's most known for.
Yeah, it's much more than I thought. So are there any contraindications to cupping?
There are a few, not very many. One would definitely be if there were any broken skin. So anytime there's a lesion or there's a cut or there's bleeding, we definitely don't want to be placing cups over that area. And then anytime there's a lot of loose skin, if there's too much loose skin, that can create an issue. We also will sometimes shave the area if there's a lot of hair on the back or arms or legs, wherever we're using the cups. We might actually want to remove that just in case there's any chafing or burning that could occur, or excessive dryness. But other than that, cupping is pretty safe for most people.
So we've seen all the bruises on the athletes in the Olympics. Is cupping painful or is it uncomfortable?
Yeah, actually no. Cupping is actually extremely pleasant, if anything. So there are two styles of cupping. One is going to be a suction cup and one is going to be a fire cup. I prefer fire cups because we have a little bit of a more ability to control the amount that we're cupping. And so, no, usually people relax, almost fall asleep during the cupping session. It feels very, very good, almost like a therapeutic massage.
So you were telling me earlier about this trip you were taking. Why don't you...
Yes, so I'm actually getting ready to go to Nepal. I'm going on a medical service trip, which is going to be really incredible. I'm going with a team of 19 other acupuncturists. We will not be cupping, but we will be doing acupuncture and moxibustion, which is another modality in Chinese medicine. We are flying into Kathmandu, and we're going to be working with children in an orphanage, and then we're going to be working with monks in a monastery, and then flying to a region called Humla, which is actually the northwesternmost region of Nepal, and we're going to be trekking for 16 days and setting up 4 clinics. So 4 clinics, 4 villages, 16 days, and it's all complementary health care.
Wow.
They treated 550 people last year, and they're expecting to treat close to 700 this year.
That's amazing.
So it's going to be an amazing adventure.
Amazing is right, yeah.
Yeah.
Can you show us a demonstration of cupping?
Absolutely, I would
Great.
love to.
Thank you.
Yeah. Alright, so here we have Dave on the table. Dave has some chronic tightness through his hamstrings. From being a runner, a lot of times athletes, we tend to get a lot of just stiffness or pain just from overuse of the muscles, and a lot of us don't take time off to rest and let that lactic acid dissolve. So we're going to do moving cupping on his hamstrings today, which is a very gentle therapeutic methodology of cupping. And then after this, we'll show you a little bit of still cupping on a patient's upper back. So 2 different forms. And then this is the traditional fire cupping method also.
I expected it to be warm.
Sometimes, yeah, it's not too. There is a technique that the ancients use, or that is listed in the textbooks rather, where they actually heat the outer edge of the cup, but for safety purposes, we don't practice that any longer. So, is the suction okay? Is it too tight?
No, it feels great.
Yeah. So I can even just feel right off the bat that there is a lot of stagnation through the hamstring, especially at the attachment site here. So this would probably be something that you would enjoy. Good relief from over time. So we'll see what happens here with his hamstrings, but when there is a lot of stagnation, we'll tend to get a little of petique, which is that bruising that you can see. And that's just the blood flow coming to the surface.
So will I be able to swim in the Olympics because of this?
You'll be, let's see, a couple more steps closer.
Maybe PR my next race.
Yes, for sure. So I'm leaving these on a little bit longer, just because there's a little bit more stagnation right in this area. So I just decided to let these two rest a little bit longer. So they can stay anywhere from 5 minutes to 20 minutes, depending on how much stagnation is in the area. And even when a patient is having pain only on one side, I tend to work bilaterally, because sometimes pain can be referred, or sometimes tightness on one side can actually be coming from an area of injury or an issue on the opposite side. So I like to always create balance there. Okay, so here we are back in the treatment room. We're looking at the hamstrings here, where we did a little bit of moving cupping as well as some still cupping. And even from what I could feel in the beginning, it was his right hamstring that had a little bit more tension and knots in it. And we did get a little bit of a heavier suction on this side too. We did some moving cupping, but you can actually see a little bit of what we call petique here, where the blood has flown up into the surface. So hopefully over the next day or 2 days, with a little bit of arnica, some Tramiel, that will dissipate, but then the hamstring will be much more loose and there won't be as much grittiness in that muscle. So we'll have to get some feedback from Dave in a little bit.
Yes. Good morning. My hamstring feels a little looser today, which is surprising because a lot of this therapy usually takes 24 to even 48 hours before you feel the full benefits of it. So I expect my hamstring to actually loosen up throughout the day. We'd like to thank Dr. Katherine Borse for doing this with us and showing us her amazing cupping technique. You can find links to her on our website, realfit.net. Please come to our website often and check for new videos. We should have a lot of new content coming up really soon. Thanks so much, and I think I'm going to go for a run. I don't think I use my legs enough.